Hi, Lisa Anderson here from A Healing Place, Complete Counseling Care. And today I want to continue on the track of talking about childhood mental health disorders. May is Mental Health Awareness Month, so I want to keep that way of thinking about mental health going. And so today I want to talk about disruptive mood dysregulation disorder, which is also known as DMDD. And what's important to understand about DMDD is it's a pretty newer diagnosis that has come since the new DSM-5 has been developed. So the DSM-5 is the way that clinicians and psychiatrists and psychologists diagnose mental health disorders. And DSM-5, there was a creation of the DMDD. And what this is it's a really where there's a mood dysregulation going on with a child. So, and then we're talking pretty extreme. So every kid might have a temper outburst or get mad or kind of swat at their sibling because they're mad. But people or children with DMDD, it's really frequent. It's very severe, and it's also really inconsistent with the situation at hand and their age and development level. So, it's really that they're swearing at people, that they're throwing fits that are beyond what normally would. Like if they're being told they have to go put away their dishes and they fall to the ground and scream, or I start swearing, I hate you, and calling names or swinging and hitting at people. It's kids who really can't control that emotional outburst. And so the key to this particular disorder is the frequency of the child's outburst. So you've got to think about that again. Kids can get irritable or angry, but this is a pretty common, almost daily, if not daily, occurrence. And so some parents are like, well, that's just my kid, he's just moody. Well, maybe not. Maybe there's really this disorder, chemical imbalance going on, and that's creating these mood swings. And so it's really important to understand that you want to get that checked out, because there is help for that. So, to diagnose DMDD, you're going to want to really get to a clinician or a therapist or psychologist who is able and familiar with the symptoms of this and really make a good decision about DMDD. Now, there are a lot of other things could create these same kind of behaviors. Depression can do that. Anxiety can do that. Attention deficit hyperactivity disorder can do that. So you want to really make sure you're going to a reputable person who could truly screen in or screen out this disorder. And so when you're talking about DMDD, you again remember that it has to be a very significant and severe behavior, and the onset of these symptoms typically have to take place before age 10. So this is something that's been going on for years, not just like for the last 2 months my child's had this, because that could be a situational issue. And so when you're talking about DMD treatment, one of the things that I get asked about this a lot is, how do you treat this? Well, it's like many things, there's two components to it. You want to do psychotherapy with parent training, because parents really need to learn how to deal with this differently. A lot of times they don't realize that they are actually creating a bigger situation by the way they're reacting than if they would react differently. And I understand when a child is swearing at you, kicking, hitting, yelling, it's very hard to remain calm and not want to yell back or not send them to the room or do these different behaviors. But that's like throwing fuel on the fire. You really need to stay calm. Right then is not the time to address the behavior. And when they're calmer, talk about the behavior. So there does need to be consequence for the behavior, but it's not in that moment, because in that moment they are in the back part of their brain, which is where we have our fight and flight response, and they are not tracking what you're saying. You're just creating a bigger situation. So that is not the time to have a discussion. So parent training is very important when we talk about DMDD. The other part of this is medication. So, people ask me all the time, why do we want to medicate children? Why does everyone want to medicate children? And I can tell you honestly, I am not the biggest proponent of medications for children unless it's necessary. Now, in my experience, this is my professional experience with DMDD, it's been necessary 9 out of 10 times, just because there's such a chemical imbalance going on. So when you talk about medications that can be prescribed, they're going to use a possible stimulant medication, or they might use an SSRI, which is usually the best way to help stabilize mood. And if that doesn't happen, they might throw in an atypical medication like Risperdal to help manage that mood. You got to get that mood under control so that you can do the behavioral cognitive steps necessary to help control the anger. And so when you talk about that, people tend to get like, I don't want my kid on medication. And I get that. I get that you feel like somehow this is a stigma, but I need parents to understand that your child is suffering. And because you have this predisposed biased against medication because of things you either think people are going to think, or you've heard on certain internet TV shows, or read on the Facebook, or seen in a commercial, That doesn't necessarily mean that what your belief system is best for your child. If your child had diabetes and needed insulin, you wouldn't even think twice about that. You would do what you need to do. The brain is just another organ in the body, and when it has a chemical imbalance, such as a pancreas has with diabetes, then it needs the medication to right the chemical balance. This is not something you've done wrong. This is not something to be ashamed of. It is just a fact. So if your child needs medication, don't run away from medication. Now, I know that some people are like, well, what about the side effects? Can it affect their growth? Can it affect their development? And certainly there are certain medications that you do want to be more aware of, but that's why you go and see the doctor to track that. You have a team that helps you. And that's one of the things that a therapist can do, which is help track how are things going. So really, I do want to help parents understand if someone suggests medication, especially someone like myself, who I don't go to medication quickly, it's pretty significant because I don't want kids to be medicated either if they don't need to be. And so the other thing about DMDD is there's often, as in many mental health diagnoses, there's a lot of comorbidity. So you will see depression, you might see anxiety, oppositional defiance is often involved with DMDD. And so you again want to go to a clinician because that clinician is able to really determine what is going on and get you into the best treatment plan. Now, again, in Wisconsin, clinicians cannot prescribe medication, but your nurse practitioners can, your physician's assistants, psychiatrists, medical doctors, all of those individuals can prescribe medication. So you want to make sure you're going to someone you trust. You want to make sure that you're going to someone that you can answer all of your questions. I know it can be very scary when your child is diagnosed with some type of mental health disorder, but it's really about how you choose to look at it. And if you look at it like this is just an organ in the brain that has a chemical imbalance like any other organ can have in our bodies, then you're going to be more relaxed about it. But if you like, oh my gosh, my child is defective, there's something wrong with them or something wrong with me, then you're going to see it very negatively and you're going to put stigma onto that child for something that is not their fault. So please try to reach out to organizations like NAMI, the National Alliance of Mental Illness, to educate yourself about how to react when a loved one has a mental health disorder, and also to educate yourself about the mental health disorder. Because even though the anger and frustration that you're going through and they're going through is not always within their control, definitely they need to learn how to control it, and they can do that through chemical balance. So I hope that this is something that has taught you to think about how your child's mental health and how you respond to your child's mental health differently. I will see you soon. Take care, and I will hopefully have